in about 2 hours. Why visiting an indoor tanning salon even once in your life? Bad idea. All right, in today's RX Factor, the unhealthy glow from tanning beds. You've seen them around, you see them in pictures. Well, there's some new research that shows that people who tan indoors have nearly a 75% greater risk than developing melanoma than people who never use a tanning bed. Well, melanoma is the deadliest form of cancer, as many of you know. Dr. Susan Evans is a dermatologist in Beverly Hills and is the co-founder of the Skin Deformities and Research Foundation. Dr. Evans, I see this 75% number. It is frightening. What do you think?
This is alarming. It's a real epidemic. There's an increase in skin cancer, making it the most common cancer out of all cancers.
So if that is to be true, what should we be looking out for things such as in moles, if we develop a mole on our skin?
Well, first of all, for the large group of people that are going to the tanning booths, apparently it's estimated somewhere around 30 million people per year are still going to tanning booths. Stay away from the tanning booths altogether, because as you mentioned, it's an increased risk of getting melanoma, as much as 75%. But if you do have a mole on your body, you look at the ABCDs of that mole. Is it asymmetrical, meaning if it's cut down the middle, is it even on both sides? Are the borders normal? Is it a change in color? Also, you want to know, what is the diameter? Is it bigger than the end of a pen, say for instance, or a pencil? And I always add an E for evolving. If something is changing, you should get into your dermatologist as soon as possible and get it evaluated.
So self-analysis, self-evaluation, and go see your dermatologist, such as yourself, to make sure that you're okay. Right.
Right. Self-analysis is good, but you always have to get it backed up by your dermatologist.
And how? And how? What are some of the alternatives here when we take a look at this, Dr. Evans, to going to these tanning booths? Yeah.
Well, there's spray-on tans that, you know, they may not be ideal, but they're still safe. There's other type of tans that you can get at the drugstore that you can just apply daily until you get the even sort of bronze tones that you want to be. And the last but least is to learn to love the skin that you're in.
And in loving the skin that you're in, but if you do not like the skin that you're in, you decide to put on that tanning lotion, isn't that also toxic?
No, tanning lotions are not. I mean, I cannot speak for each of them, but there are definitely safe alternatives available to you at the drugstore that are okay.
Okay. Another recent study is bringing up a word called tanorexia. What is tanorexia?
Unfortunately, I'm all too familiar with the term.
Really?
I practice in Beverly Hills, and I have many celebrity clients that are very concerned about the way they look, and they still go despite the fact that they know that there's a risk of cancer. And when you get to the point where you're going so regularly, frequently, that you're defying any sort of logic, you're a tanorexic.
Okay, and that goes back to your point, being fine in your own skin, being very comfortable in that. What are some of the indications if you think someone might be, or to be able to tell if someone is suffering from tanorexia?
Well, surprisingly, even with all the risks being known, people are honest and say, you know, I am still going to the tanning booth, doctor. I'm so sorry, but I saw this mole and I want to check it. And there's plenty of celebrities that go public with the fact that they are still going and have even home tanners. So it's not as much detective work as you would think. And also, of course, when they come in and they're really tan and we know it wasn't because of sun exposure, they've been to the tanning booth.
My producer and I were talking about this. Is this something that's only of the 2000s and the 80s, the 90s, you know, really wasn't necessarily a big thing to do, to go out and get a big tan? Is this something that you see that happens in cycles?
Well, there's now, during the 70s, most people were doing a lot of their tannings outside, you know, from the regular ultraviolet rays from the sun, which is not as dangerous. But now there's an ample supply of these indoor tanning places that allow you to get these super intensive rays for a shorter length of time, but they're also causing an increased rate of skin cancer. It may not directly be related to to the tanning booths, but there's definitely an increased incidence. There's over 1 million cases of skin cancer each year.
So technology is good. It's faster, more efficient, but worse for our body if you do want a tan, is what you're saying. Dr. Susan Evans, thank you so much for filling us in on all of this. We appreciate it.
My pleasure.
Very, very interesting.
My pleasure.